My name is Morgan Norris, and I'll be doing a bed bath today. The reason we do a bed bath is to promote cleanliness. We don't want the patient to be dirty, because where there is dirt, there can be an infection, there can be an ulcer, there can be skin irritation, anything like that. The first thing what you want to do is, before you get in there, is to make sure you have all of your supplies. You're going to need bath cloths, you're going to need towels, you're going to need a basin to keep the water in, and soap if they want the soap, and a bed sheet or a bed towel sheet to go over the patient to keep him covered. The next thing you're going to do is you're going to go in the room. My name is Morgan. I'm going to be giving you a bed bath today, and we're going to get 2 identifiers from his wrist. Can you tell me you're going to ask for their first and last name and their birthday, and make sure it corresponds with their wristband and your charts. The next thing you're going to do is ask if they prefer any soap in their water, if they would just like water. Would you like any soap, or would you just like water?
Soap would be good.
Okay. The next thing you're going to do is, there is a basin here with soap. We're going to make sure we wrap our hand with a mitten. This is what the mitten looks like. And you're going to make sure that you have a towel over them, a bed sheet to go over, bath sheet over them, just to keep them from getting wet. And then you have another towel to go underneath them wherever you're going to be using, because you don't want to get water in their bed and let them sit in the water. Again, we're going to use the mitten. First thing we're going to do is their face. And you ask them to close their eyes. And you're going to do inside to the out of one eye. You're going to get it wet again. Make sure you don't contaminate the other eye. You don't spread the germs. Then you're going to do the other side. And you're going to wet it again to get all those germs out. Again, you're still using the mitten. If they have a mask on, you're going to remove it, and you're going to do the face on one side, making sure you get from their forehead to their cheek and down in their neck. And then you'll put the mask back. And then on the other side, you would do again from the forehead to the cheek to the neck. And put the mask back. Still trying to keep them safe. And getting it wet, making sure you get all the bacteria out. Do the mitten again. We're going to use our towel to put underneath their arm. Alright. We're going to take their gown off to help get their arms clean, and then we're going to do their chest later, and their abdomen, their stomach. You're going to start with the arm that doesn't have an IV. He doesn't have an IV, but if he were to have an IV on this arm, we would do this arm first. Make sure to get this arm safely out. And then on this side, we would have to string the IV through the sleeve, and then safely get it out and take the gown off of them. You put the mitten on. Again, you have the towel underneath their arm to keep the water from getting in the vent. You start from the fingertips and you go all the way up with strokes, burn strokes. Making sure you always rinse out the rag. Again, doing the mitten. Doing up here in his arm. Making sure you get in his armpit, because you don't want any place not being cleaned. And you want to make sure to do the back of his arm and doing his hand. Again, we're going to put that back in the basin, and we'll move this. Next, we're going to do the other arm. Then we'll use the mitten. And we'll start from fingertip and go all the way up with long strokes, making sure you get in his arm. And rinsing it out every so often to make sure you're not contaminating the rest of the skin. And making sure you get in their armpits, because again, you don't want any place left untouched or left unclean. You do not want any type of infections. You'll move the towel. Now you can do the legs. Okay. You always want to promote privacy, so you always want to keep him covered as much as possible so he's not exposed to anything. You're going to lift his leg up. Always having support around the joints because they might not be strong enough to lift it themselves and you don't want them to hurt themselves. To the mitten. And you start from the feet and you go up. And you do the leg. Long strokes with the bath cloth again. And you go all the way up to the hip. And make sure you get that. Here, let it again. And you make sure you get their feet. You want to make sure you get their heel. You get the sole of their foot. You want to get in between their toes. You don't want any place not being cleaned. Alright, we're going to lift your leg up again, sir. And we'll cover them back up again. Now we're going to do the other side. And we're going to use the mitt. Again, going from the foot, making sure you get every part, making sure everything's clean. I'm wetting the bath cloth, making sure you get on their thigh, in between their thigh, any places like that, making sure everything is clean. Wet it again. And now you're going to do their foot. Again, making sure you get their heel. You get the sole of their foot and you get in between their toes because you want everything clean. Alright, sir. I'm going to lift your foot up. Cover them back up. Alright. Next thing we're going to do is their chest. Okay, we're going to pull it back. And then we're going to go up and down, strokes. We want to make sure everything is clean. Again, we want to do the sides. We don't want any part untouched. And again, we're going to go up and down, making sure to get everywhere. If you didn't get any in between their arms, make sure you do it then. Make sure you go up and down. Okay? The last thing we're going to do is we're going to do his back. We're going to assist the patient to roll on the side of his side. All right. We're going to go up and down, making sure you get everything, making sure you're looking for any type of bed sore, any type of skin irritation. If they would like lotion, you can put it on their back after you get done washing. Would you like any lotion today, sir?
No, I'm good.
All right. Okay. And make sure you get it all clean. All right. Come on in. Okay. Before you were to lay them down, you wanted to make sure that their back was dry. You didn't want anything wet, nothing like that. So if they were to roll over, make sure you put that towel underneath them. It is a little difficult whenever you're doing their stomach, but you can always just get a new bath cloth and wipe them down. With oral care, if the patient can do it, allow them to do their own oral care. If they're unconscious or they're not competent enough to do it, make sure that you turn them to the side to do it. And you go from, make sure you get their gums really well, up and down, bristles. Make sure you scrub really hard, or not too hard. You don't want it to cause any like gingivitis or anything like that. You don't want their mouths to be bleeding, but you want to get it clean because you don't want any infections in their mouth. With dentures, you make sure that you perform proper hand hygiene. Make sure you have gloves on. What you're going to do is you're going to make sure that they do have dentures in before you stick your hand in their mouth. When they tell you that they do have dentures, you're going to take the top part out. Make sure you have the basin ready. You're going to put the top ones in. And then you're going to grab the bottom one. You're going to pull them out. And you're going to put them in the basin and put them in the bathroom to soak. Okay? With nail care, you can soak their hands while you're giving them a bath. If they would like them done, you can trim them, you can file them, you can clip them, you can do whatever they want. And you can do it on their fingernails, you can do it on their toes, whatever the patient prefers. Okay, with females, whenever you are cleaning the perineal area, you want to make sure that you have gloves on. And you want to have 3 clean wipes or bath cloths. What you would do is you would use your undominant hand and separate the labia. And you would clean from the side farthest away from you one time, front to back, the side closest from you, front to back, and in the middle, front to back, making sure every place was clean. With the male, you want to make sure you grab their penis, pull it up, not too hard, to be gentle, to clean underneath the penis, around the penis, around the meatus, to make sure that if they are not uncircumcised, to pull back the foreskin, make sure you clean around in there, and just make sure every place is clean.